Hello, and welcome to our third session of the Healing Journey program, as you will be presenting it to group members. Today, we're going to be looking at imagery of cancer, imagery of the immune system. Some people come to this session with great trepidation. It can be anxiety-provoking, imagining cancer existing in the body. I could remember my own experience was that I found that this one was hard to do. And yet my own dreams were informing me like crazy that I was having a lot of imagery in my dreams about what I feared in terms of having cancer. Some people will come to this session actively engaged in fighting cancer or living with cancer as a chronic illness. And some people will have had the cancer surgically removed, and they'll feel, well, why should I be looking for it if I'm imagining that it's not there? Isn't it healthier to imagine it's not there? These are some of the challenges that people will come to this session with. In terms of our understanding of the immune system, do we know that imagery actually influences the immune system? Well, it's a really good question. And I think that what we do understand is that calmness, decreased allostatic load enhances immune function. It's very hard to take apart imagery from the relaxation process that we use in order to experience imagery in this kind of context. I think what it really allows us to do is explore our relationship, our thoughts, and our feelings relative to the disease and to our bodies that are engaged in actively healing us. So whether or not it actually enhances immune function has been very hard to tell, because it's hard to take it apart from relaxation. So knowing that it's a complex system, we can't make that direct connection, but we can say that therapeutically it has value. It has value in that it is empowering to think of ourselves as not passive recipients of medical treatment, but to understand that our bodies are actively engaged in helping us heal. It also gives us a chance to work with symbols. When I had breast cancer, the symbol that kept coming up in dreams was snakes. I'm quite snake phobic, so that made a lot of sense. I was very frightened of snakes, and I was very frightened of cancer. But I remember a pivotal dream in which I realized the cancer, or the snake, was actually a rubber snake, and it couldn't harm me. And that was a very powerful dream that I still remember now with great energy. And my immune system became symbolized by a mongoose. A mongoose, you ask? Well, this is an example of how imagery is highly individual. As a child, I was given the story Rikki Tikki Tavi, which is a Rudyard Kipling story about a mongoose who looks after a little boy and patrols the garden and kills off snakes that are very fierce. He had tenacity, he was brave, he was strong, he may have been small, but he was mighty, and he guarded that garden really well. And there are some really excellent descriptions of that, the interactions, and I remember being riveted as a child. And so that imagery of a mongoose became really helpful to me, really powerful to me, that in some ways I felt small in the face of this challenge, but in other ways I knew that size didn't have anything to do with it. It had to do with ferocity and tenacity, of which I felt with a fair amount. So it's an example of how imagery can be idiosyncratic. It's you wouldn't understand the mongoose connection unless I explained the story of Rikki Tikki Tavi to you. It may seem silly to other people, but it was profound, very profound for me. So it's in the telling of the story, it's in the opening up of the unconscious, looking at the relationships. Many people will report that they're already doing this in dreams. This gives them a chance to put it out on paper. Which brings us to the second point. We do this kind of imagery in both level 1 and level 2. And so I'm going to try to put both of those sessions together today so that after this session, you'll feel ready to do the session. It's actually session 3 in level 2 that we won't have to cover it again because you'll have a good handle on it, hopefully after participating here with this today. In level 1, the difference would be we don't ask people to draw it. We do ask them in the workbook to experiment with drawing it, but we don't ask them to draw it and show it in the circle. In level 2, we do. And so we want to talk a little bit about how we might help people open up the image for themselves to help them understand what it might be that they're telling themselves or what the imagery means to them. This is not the process of having secret information and seeing things that the client can't see or that the member can't see. It's their image, it's their story, and we're not here to impose an interpretation on anybody's image. Rather, we're here to help them discover what this image might hold for them, what power or what meaning it might have, whether it's useful, whether they'd like to see it change, whether it reflects the mood they're in today. Many people produce highly variable images. On good days, it's empowered. On hard days, it's less empowered. That's part of the roller coaster, and that's just fine. We want to be able to not be frightened of that, but to just view it as information. It's kind of taking us back to healthy thought management, which we'll talk about again in this session, because healthy thought management is the way that we handle images that may be uncomfortable or a process that may feel uncomfortable. What do I do about the image that's uncomfortable for me? Snakes are very scary. Is it possible to use healthy thought management to reframe that? Okay, I recognize that I'm scared. I recognize the thoughts are deep and that the symbols are deep for me. But what does it also offer me? Well, maybe it offers me ways of managing that, like containing it. I remember in one dream, the snake was in an aquarium, and the idea being I could see it, but it was contained. It was within a box. And that's when it morphed actually into a rubber snake, and I realized it wasn't going to hurt me. So we can play with this. Now some people are more inclined to the fanciful, and some people are more concrete, and that's fine. This is really a bit of a smorgasbord where we're offering people different ways in, and for some people, they will gravitate towards some strategies more than others, and that's fine too. We're just offering it as an opportunity. So I hope that that's a helpful way to begin today. So what we want to do is move along into the session itself. So I'm just going to share my screen. Here we go. And this is the slide that you'll have up when people enter the room. So these are some interesting quotes. There is no such thing as a completely sick person or a completely healthy person. That's really interesting, isn't it? The idea being that actually cancer probably per square inch is pretty small in the fullness of the person. And it's kind of putting it on the shelf and saying, there's a lot about you that's working well. And we also want to be able to acknowledge that. Because you are diagnosed as ill, it is not a requirement that you feel sick. This is Rona Jevney. And that's an interesting point because many people who are diagnosed with cancer don't actually feel ill. Some people do, but until the treatment starts, like breast cancer generally doesn't come along with a whole lot of symptomology, maybe tiredness, but not much else. It's not until the treatment starts that you feel sick. So I think here what we're saying is there's more to you than the illness. So we'll begin, as we always begin, with a relaxation, remembering that it's a grounding. And I hope that you are beginning to work up your own script, your own way of helping people focus on the breath. Feel the breath in the body. Shift the gears. We can also begin to include clearing the mind. bringing people back to the sound of the breath. This is a really helpful strategy. The breath is always with us. We take it wherever we go. And so it's something you have in the doctor's office, you have during a procedure, you have in the MRI, you have your breath to take with you. And if we can hook the breath into the relaxation response, then we have a way of accessing that too. So in a way, it's a portal. Added to that is the Om. I hope you're becoming more comfortable with the Om. Even the act of Oming, I'm sure that's a verb, but you know what I mean, it gives us a chance to really experience our breath more deeply as a vibration, as a sound, as a breath. So I'm just going to do an Om just to center myself as I begin today's session. Om. And so you might want to play with that sound. Om has a lot of vowels in it. So you start with an ow. You can do all kinds of things with it. Play with the sound so that it feels right. And notice how it's hard to do anything else when you're oming but Om. It's hard to think. It's hard to be distracted. You're really, really in the moment. So we welcome people back to the group. If you feel it's important, we can do a quick reminder about confidentiality always being in place. I always like to say to people, you're welcome to raise confidentiality as an issue at any point in the group. It's okay to say to somebody, to say to the group, just want to be sure here that confidentiality is in place, and everybody nods. Sometimes they even get people to place their hands on their hearts and say, I pledge, promise to keep confidentiality. I like the movement. I like adding, I think part of this is sort of moving the body in a way that confers our agreement. It deepens our connection to it. So welcome back. Here we are. And what did we look at last week? We looked at managing thoughts and feelings. And we had a simple process, really, acknowledging the thoughts, being aware of those thoughts and emotions that follow, really becoming aware of what is flowing around the mind. It's a question of opening up a book in a way and having a look at the pages. Thought watching is like looking at the book of your mind and seeing what's going on in there. After all, it's pretty powerful stuff. It can hijack you, it can soothe you, it can change your mood. So let's be aware of those thoughts. When we find thoughts that are sticky or uncomfortable, what we want to do is move them out. Someone said it's like evicting unwanted tenants in the attic. Out you go. I don't want that thought. That's not a healing thought. That's not a helpful thought. We can even ask ourselves, is that an accurate thought? Is that true? Just bringing that gentle curiosity, that gentle challenge. Really, is that true? Let me look at that more deeply. That's a way also to challenge thoughts gently, not with a punitive sense or with a judgmental sense, but just this gentle curiosity. Really? Is that true? We want to express those thoughts, those feelings. We want to let them go. Ways of doing that, of course, exercise, music, Om, writing about them. We keep coming back to writing about them. And relaxation, letting go. I think going for a walk really can be a big game changer. It changes our sensory stimulation. It gets us out of the box. It causes us to breathe more deeply. It helps us become more aware of what is around us, and it gets us out of the cycling inside of the head. And people even who are not feeling well can sit outside or sit in front of a window. Bird feeders are wonderful for this. Sitting in front of a window with a bird feeder gets us out of our heads and into nature. Then what we want to do is substitute more helpful, more healing thoughts and actions. versus, so I have nothing I can do to help myself. I will do everything I can to help myself. In a way, this is introducing affirmations. Affirmations don't have to be grand. They don't have to be, I am getting better and better every day in every way. One of my simple ones has been, I'm doing the best I can with what I've got. It feels a little more spacious than the judgmental voice that says you should be doing better. So what we can do is we repeat 1 to 3 many times, because this is not a one-stop process. This is a multiple step process. We have to keep at it. And in time, it can become a habit, but we have months and months of healing journey before that usually occurs. People will say that some emotions are good, some emotions are bad. The most common language around that is negative and positive. And for me, I don't think feelings come in these boxes. I think of them more as a spectrum. I also don't think of them as particularly negative or positive. I think of them as comfortable and uncomfortable. Feeling sad is an uncomfortable feeling, but it's informative. It tells me how I'm doing. Feeling angry is an uncomfortable feeling, but it's information about what's going on around me and how I feel about that, and is worthy of investigation. One way of looking at it is the only bad emotion is a stuck one, particularly if it's at that bottom of the roller coaster. If people find themselves at the bottom of the roller coaster, it means they're kind of stuck. Depression is very common with cancer. Why wouldn't it be? And often there are lots of reasons for that depression beyond the fear and the trauma of the cancer itself. There is the treatments. If you've had surgery, there are anesthetics. They know they can behave as depressants. There's chemotherapy that can behave as a depressant, changes brain chemistry, right? There can be ongoing hormonal medications, which definitely change mood, because hormones are part of mood modulation. So when people are getting stuck into a depressed position, it's very helpful to talk to a professional, a mental health professional. That could take form of social worker or a psychotherapist, a psychologist, or psychiatrist. Most hospitals that treat cancer patients in any significant number will have something called a psycho-oncology department. Psycho-oncology department will have people who are trained in oncology and who understand the mental health impacts. And so sometimes you can self-refer, sometimes you need your doctor to refer. Going to see a mental health professional is another tool in your toolbox. It's another member of your healthcare team. It's not a judgment. How would we ever be expected to manage to cope with everything that comes at cancer patients and caregivers without having some guidance? So if you notice that your mood is getting stuck, that's an indication that you need to talk to somebody, to find someone to do some problem solving with, to actually go through this process of acknowledging the thoughts and expressing the feelings. Sometimes medication is suggested, and many of us are loathed to take medication to manage mood. It's like we're judging ourselves. Gee, I'm in the healing journey. I should be able to manage this depression. I should be able to manage this sadness. The way I've come to look at it is that all of the experiences of coping with cancer are kind of like a closed head injury. Nobody can see it, but you've been knocked on the side of the head many times, and the brain's rattling around in there. Sometimes we need medication in order to create a scaffold. Think of it as a scaffold from which we begin to build the coping strategies. Too much depression makes it very hard to learn, to concentrate, to focus. Medication can help create that scaffold from which we can then build up. And in time, you won't need it. I'm not advocating medication. I'm just saying it's important to be open to that possibility that it may be helpful to you without judging yourself. Any thoughts and feelings about managing thoughts and feelings? This is where we ask the group how they're doing. We can ask about some of the homework that they've been doing in their journal or their workbook. Going through it, have you had a chance to use this model? Can anybody, always asking for examples, can you give me an example of that? When people say, yeah, I've used it and it was great, that's wonderful, but I don't want to know more. So we ask people, can you tell me more about how that worked for you? Can you give us an example of how that worked for you? Real live examples are more instructive than broad strokes. Also attached to that, it's really helpful to hear from the group telling us how helpful it is rather than us advocating it. It's wonderful when somebody in the group steps forward and says, yeah, I tried it and this is what it was like and this is how it felt. And yeah, it's not easy, but I'm learning. Those stories are great. And even stories where people are saying, I am having a heck of a time. I just can't seem to move through this process. That gives other people a chance to step in and help them and say, yeah, well, I get that. I know how hard that is. This is how I've been doing it. Mutual support and altruism, helping each other, is part of what feels good about being in a group. And we want to encourage those kinds of connections. So using the mind to heal the body, we're beginning to see that there are all these connections. Thoughts create emotions and images. I think those arrows can go the other way too. I think that emotions and images can also create more thoughts. And we know that these have an effect on the body. And today we're going to talk about imagery. Imagery as a tool for self-help. And in fact, as we move along the healing journey, there will be activities that involve imagery. And in fact, we started with that when you created your safe room in our last week's relaxation. And in fact, we're going to use that room today in our imagery. What do we know about guided imagery? Guided imagery is a process of a facilitator offering you ideas to encourage you to imagine things, to use your imagination. Often it involves imagining a safe, calm place. Safe places are really important. It's kind of like having a secret place inside of yourself that you can go to when you're feeling stressed. There's research on the effects of imagery. Imagery has been found to improve vital signs in COVID patients. This is a wonderful idea that wound healing and less anxiety after surgery can be an effect of guided imagery, so that when we're calm and we're relaxed and we're imagining safe places and we're less anxious, our body functions more efficiently. Improving symptoms from chemotherapy. It's useful in pain management. Now, I'm not saying that we should be able to image away our pain, but using imagery in conjunction with pain medication is a very effective combination. As the pain medication begins to work, using that lift to imagine a healing, safe place can really help us feel better. It may have an influence on the immune function. I'd say that if we're seeing wound healing improvements, then that's suggesting that the immune function is involved in some way. It's hard to assess immune function because it goes up and down, and it's very hard to take relaxation out of the equation of imagery. Most of us need the relaxation to produce the kind of healing imagery that we're going to do today. So I'm not sure whether it has a direct influence on the immune system, but I do know that can be a part of feeling empowered and feeling calmer. Anywhere along these slides, we're going to be asking people what they think, encouraging conversation. And I think one of the things that people may be wondering is, wow, how am I going to be able to do this? I'm not a very good imager. And it's not wrong. Some of us are more eidetic than others. Some of us are better at seeing pictures in our heads. But I think it's also important to know that it's not always a visual, like, surround sound, Lucas sound. It's not like a movie where we expect to have vivid, all-encompassing images that feel like a movie. Usually it's a flitting or fleeting sense of it. Daydreaming is a good example. It's not quite like a movie, but it's a different headspace. It has feelings. So really what we're talking about with imagery is a mental representation of an experience. So I'm going to ask you, I want you to think about where you live. I'm going to ask you, how many windows do you have? Because I'm going to offer to clean them. Well, okay, maybe not really, but let's just take a moment to count the windows in your home. And when we do this, when we ask people to do this, you'll see them kind of, sometimes they actually do this. So that's that mental representation right there. And then we ask, so how many windows do you have? 7, 10, 14. And then I'll ask, how do you know? How do you know that? And so like counted them, right? 1, 2, 3, 4, 5. Well, your windows aren't here. How did you count them? I counted them in my head. Bingo. That's imagery. So some people can see them and some people feel them and some people sense them. We have lots of ways that imagery happens. And it's not just visual. Let's work with a map for a minute. How do you get to your local store for grocery shopping? How do you move from where you are now to your local store? I go to the front door and I turn right, and I walk up the street and I turn left and I turn right again. You notice that lots of people use their hands. I go to the door and I turn right and I go to the street and I turn left. And these hand motions are an example of how people are recreating a mental representation because they're feeling their way in. Oh, it's up here and it's down here. There's a big hill. There's a down the hill. When we see people moving, we know that they're engaging with this mental representation. One of the things that we may believe is that all imagery is visual. That's why we try not to call it visualizations. We try to call this process imagery because visualization suggests we can see it. And we can to some extent, but often it's a multi-sensorial experience. Let's think about an example. Can you imagine, you can close your eyes for a moment. Can you imagine a bird singing? A dog barking? Church bells ringing? Can you imagine the smell of an apple pie just out of the oven? Or fresh bread? Or that fresh smell in the garden first thing in the morning? Can you imagine smelling a rose? Can you feel in your hands sensation of grass, velvet, sand, like at the beach? Letting yourself experience it at different levels. Can you imagine stroking a cat? Not if you're allergic, of course. Now stroke that cat backwards. Ow. Can you hear the cat? So we can be playful with this. And sometimes the group is quite surprised at how they can produce images. I sometimes think it's kind of like taking a DVD and dropping it into your player and then seeing it or experiencing it again. This is a way that we hold on to memories. And in fact, the younger we are, sometimes the more sort of sensorial they are. I've got memories of a child that are the smells of things. Very primitive. It's a very primitive thing, but it's very powerful, very, very evocative. That's why smells are great memory prompters. Let's imagine then, we've done some imagining to give people a chance to feel that. And then we want to talk about how we use imagery all the time. Where are your house keys? Right this minute, where are they? Can you imagine that? And sometimes we see people moving. Even as I sit here, I think, I know where they're on the hook. You see, on the hook or in my purse. That's another sort of see people going. And I'll ask them, how do you know your key is there? Because I remember putting it there. How do you remember it? What's that memory? How did you store that memory? In words? No, it's emotion. It's a movement. Put it in my purse. So there, that's a form of imagery too. And we use that every day. Grocery shopping. What's on the list? Right? What did I need? That's going through a mental list. It's going through sometimes through the cupboard or in the fridge. Or I have a chalkboard that I write things on. So I'm imagining the chalkboard. So those are all examples of images. Images affect our body. Now that's an interesting idea. And that's a powerful idea. So let's take a moment to do a little exercise. I want you just to close your eyes and to take a breath. Now, I want you to imagine you're in your home and going into the kitchen. Perhaps your feet are bare. You can feel the floor under your feet, or maybe you're wearing your favorite slippers. You feel your slippers. But you're going to go towards the fridge and you're going to open the door. Feel the handle and that slight tug that you need as you open the door. Then the fridge door opens, it swings open, and you might feel the coolness. It might be light, the light of the fridge that's lit up. Now, somewhere in your fridge is a lemon. Now, some of us need to sprout around a bit in the fridge to find it. I'm probably one of those people, but other people's fridges are neat. So wherever you keep your fridges, it might be in a drawer, it might be on the shelf. Let's take a moment, find your lemon. And then close the door and let's spend some time with that lemon. Can you feel the heft of that lemon in your hand? And see the color of it. It's a very light yellow, in actual fact, usually. Some lemons have knobs at the ends, and some lemons are just elliptical, just round. Some of them are big, some of them are small. Let's take a moment to become friends with your lemon. Notice everything. Sometimes there's a place where the stalk was. Sometimes there's a plastic label on it. You might want to take that off and feel yourself picking at it and pulling it. You might even hear it, right? You might want to feel the coldness of that lemon on your cheek. It's been in the fridge, so it's quite cold. Now, somewhere in your kitchen, you have either a small cutting board or a plate and your favorite paring knife. Maybe it's in a drawer, maybe it's on the counter. Pull that equipment together and feel it in your hands. Feel the paring knife, feel the cutting board or the plate. You might hear it if you have stone counters. You might hear that plate on the counter. Now I want you to take that knife and cut that lemon in half. It may cut like a really smooth sweep, or it may be something that you have to work at a little bit. Just notice. And as the lemon falls into two pieces, what do you see? You see the skin on the outside, which is yellow, and you see the pith, that's the white, that's just inside the skin. And then you can see all the segments of the lemon, and you can see the little sacs of juice. Maybe some of the juice is running because you've cut it. Most lemons have seeds in them. Have you cut some of the seeds in half? Let's take a moment to look. Maybe smell. Interesting, lemons don't smell that much on the inside. The smell of lemon is usually on the outside. Take a moment, explore it. And then when you're ready, take a bite. You'll know in the group who is having a strong effect from the bite of the lemon. You'll see them make a face and they'll touch their cheeks. It's a remarkable exercise in actual fact, because there is no lemon in the room, but the mind knows what a lemon is like. And the mind knows what biting into that lemon will do. And then the body does it. You get the draw of saliva from the saliva glands. Most people can produce that for themselves. I think it's a very powerful example of what imagery can give us. Imagery is used in lots of ways by athletes. It's used if you've ever, when you watch the Olympics, you'll see the skiers at the top of the hill, and they're actually moving their hands and their body to the course that they're about to ski down. You see it also in skaters who will be moving their bodies in a way that reflects that movement, reminds them of the movement. That's motor learning. It's in their bodies, and what they're doing is stimulating it so that they can feel it. We may be, sometimes when you're watching an athletic event, you may find your body jerking. That's an empathetic response of recognizing that motion and feeling it in your own body. So there's nothing esoteric about imagery. Imagery is something we really do use every day. Even people who don't see pictures in their head are still using imagery for simple tasks like finding things. And we can use it to strengthen healing responses. That's an interesting idea. We use it in psychotherapy. Old research, and it's quite old, there was some research that suggested that using imagery of the immune system could help reduce plantar warts on the body. Imagery is used for birthing babies, helping mothers relax, helping people see a good outcome. Imagery is really useful with things like having a blood draw. We had a client who found having blood draws very difficult. And by using light, the imagery of light, and making his hands warm and soft, the blood draw was much, much easier, because when we're tense and anxious, the blood, remembering the fight or flight response, is drawn away from the periphery into the muscles. So it's harder to get a good vein or artery for getting a blood draw. When he used imagery, it was suddenly easy. And I think the nurse asked him, "Are you on anticoagulants?" He says, "No, I'm on imagery." A great answer. One gentleman said he used the color orange, and when he was having a procedure, he would imagine going into orange, and that would calm him and make it so much easier. So there are lots of ways that people can use imagery, and it can be healing. One of the questions that people have is, what do I do if the imagery is scary or frightening? That sounds familiar, doesn't it? That takes us back to the idea it's a thought. It's a thought that is scary or frightening. And what we want to do is work through that. We want to be able to identify it, express it, let it go, and replace it. That's back to healthy thought management. Scary images, that's just information. It tells you something about how you're feeling. And feelings aren't scary. Feelings are experience that we can look at and share and release. Then we want to have a discussion with the group. The other thing to remember is that imagery is not the final word. Imagery changes. If you produce scary imagery in one experience, it can morph and change, and we can have some control over that too. It's worth experimenting, drawing, writing out what we're experiencing in imagery, and asking ourselves, how would I like to see this change over time? I think it's important to keep a record of these things, date it, and then see how it changes over time, because it will change. Just as you change, so too will your imagery. Drawing imagery. Well, we're not going to talk about drawing imagery very much in level 1, but it's certainly open to you to do that. In fact, I'm going to show you some imagery that has been done by members of the Healing Journey. Imagery, drawing imagery can be done in crayon, pencil. It can be done as a sketch in a book, or you can get, more ornate about it. Art therapy is a place where we experiment and work with different ways of visually representing experience and feelings. The way I think of drawing imagery is it's not about being an artist. In fact, artists will have a harder time with this because they'll get concerned about perspective and color and shading and shape and accuracy. What I prefer to see is someone just blow it out on a piece of paper. And sometimes it's like hieroglyphs. Who cares if it's stick figures? This is not for other people. This is for your investigation. If you're using stick people, that's just fine. It doesn't matter. I think of imagery really as hieroglyphs that you understand and that you can tell us about, rather than it being a photograph of what you're experiencing in your head. Because in fact, most of us are frustrated that the imageries that we produce on paper don't match the experience inside our heads, and that's okay. So just think about drawing it as a representation of what's happening here, symbols of what's happening in here, rather than a direct translation. What about the role of the immune system in cancer control? Well, we've talked a bit about this as we've moved along. We know that the development of cancer is a tremendously complex process, affected by all kinds of factors, some of which we know about and others that we don't. And very likely different people's cancer has different processes behind it. So we know that potential cancer cells emerge quite frequently in the body, and that the immune system is a surveillance system. Back to that idea of the neighborhood, they're the local cops that flow around and make sure that everything's in order. In fact, the immune system is, in essence, an organ itself. It doesn't live in a single place. It lives in the thymus, in the bone marrow, in the glands. It's not in the lymph nodes. It's not a single location. It's diffuse through the body. But it's still kind of like an organ. It's like a sensory organ, some people say. You've got, it picks up and detects things like your eyes do and your ears do. There are different kinds of immune cells that work in different ways. And we're going to take some time to have a look at those. So this is where the immune system is generated, all through the body. It doesn't live in one place. It lives throughout the body. So let's have a look at the way it functions. This is a cancer cell, the purple in the background. And what we see attacking it are natural killer cells. What a great term, natural killer cells, or NK cell. Natural killer cells are cytotoxic. What they do is they bust a hole into the cancer cell and they inject a cytotoxic chemical. Cytotoxic means that it kills cells, kind of like chemo, and it kills that cell off. This is a terrific picture because there are 6 natural killer cells attacking a single cancer cell. They look robust, they look strong, they look pretty powerful. You can download all kinds of pictures of the immune system off the net, and I suggest that if this level of understanding the immune system appeals to you, if you like to be able to visualize it, that's a great place to get some inspiration. This is a different immune cell. This is a T cell. T cells are thyroid or thymus-derived cells. They come from the thymus gland, and the thymus gland sits just beneath the breastbone. Some people like to tap it as a way of waking up the thymus gland. But the stem cells, which are juvenile infant cells, migrate to different parts of the body. And the ones that migrate to the thymus gland grow up to be T cells. Somebody once said it's like the nursery of the T cells. And so here is a T cell attacking a cancer cell. And here we have the neighborhood, right? You saw this picture before in our first session. What you see are, it's a tumor in the background. Those are cancer cells that are kind of beige. But we have all other kinds of cells in there doing their thing, fighting off the cancer. T lymphocytes, natural killer cells, all coming to bear to destroy the cancer. This is an older picture. This is a cancer cell in the background. And those, I think, are natural killer cells. Yeah, look, they're round. And one of the things about natural killer cells is that they can change shape. They can be round, that's I think their natural state, but they can also elongate. So they can travel between the lymphatic system and the blood system. So they move through membranes quite easily. And that gives them even more power to tackle the cancer wherever it's occurring. This is a great picture. This is a dead cancer cell. And that's a natural killer cell sitting on top of it, kind of vanquished. Look what I did. And that's not the end of the story, because there's also macrophages. Macrophage, the big eater. The macrophage they kill off bacteria, and they also clean up the body. The body is a clean machine, and these macrophages come in to clean up scar tissue, to clean up mess. It'll clean up the skeleton of the cancer cell that we saw in the last slide. If we look at this big eater here, it's a magnificent photograph. I could almost hear it as I look at it. It has a sort of a sense to it. And it's got this extension, and it's attacking a bacilla. You see this down here? It's an E. coli. E. coli exists naturally in the gut. We all have them, we all need them. But if they get out of the gut, we're in trouble because they can create an infection. And we know that if you get E. coli infections or E. coli contamination, it can cause serious illness. We have to be very careful about it in food and water. But this E. coli hasn't got a chance because this macrophage is on. It's on. So what we're going to do is ask you to imagine that interaction. To imagine that interaction in your body between your immune system and the cancer. Now, some of you don't have cancer. It's been cut out, it's been treated, and it's not there anymore. That's wonderful. But what you can do is bring in the immune system to be the surveillance team, to come in and mop it up, clean it up, make sure that nothing else is happening, to keep on its toes, to watch that neighborhood, to be part of your neighborhood watch in your cellular microenvironment. And for those of you who do have cancer, you can imagine bringing in all the things that you're doing to help yourself, as well as your immune system. Now, this is a visualization that is quite concrete, quite, well, realistic. And this person has labeled the things that are going on here. So in the center is a cancer cell, perhaps a small tumor. And in coming to this picture are the T lymphocytes. They're red. Natural killer cells, they're coming in too. Macrophages in the background to clean up the mess. One of the things that I really like about this is there's also healing light coming in. The healing light is pouring in. And that's really wonderful because we know that healing light, we associate that with healing. But you can also draw chemotherapy. This could just as easily be radiation therapy. All of the things that are happening that you're doing and that your body is doing to help yourself. Now, some pictures are, this is a picture of radiation and healing light coming in and attacking a tumor. So one of the things we want to do is explore, asking yourself questions. What's happening in this picture? What's going on in this picture? How effective is it? The person who looked at this picture after he drew it said, you know, I'd like to see a little more space, a little more openness so that radiation, healing light can even be more effective rather than chipping away on the outside, getting right in there. And so that's the beginning of creating your own image, saying, yeah, that's good, but I can imagine new things happening, more things happening. And so it's not a negative picture. It's a picture that's got lots of information in it and is opening the door to imagining other things happening and changing it over time. Now, these are very old pictures. This is a series of pictures that were published by Carl Simonton. Simonton was an oncologist in Texas, and he and his wife were very interested in how the mind influenced cancer, and he actually developed the technique that we're using today, imagining the immune system interacting with the cancer. It was a way of empowering people. He did a small study trying to assess whether different kinds of imagery produce different kinds of responses, but it was very small and not very well controlled. But he was a pioneer. He wrote a book called Getting Well Again, too, in which he talks about some of these techniques. So this here is a knight in shining armor. And that sheep thing that he's just skewered is a cancer cell. Notice that it doesn't have to be terribly accurate. It's not about the prettiness of the picture. It's about the power in the picture. And what's more powerful than a knight in shining armor? Yeah, it's a pretty good image. The person who drew this probably felt that he could get behind the power of a white knight. And that sheep guy with his, I love his crossed eyes. It's wonderful. He's really, truly skewered it. That's a very powerful looking sword. Or I guess it's a jousting stick. I'm not sure. I don't know that much about knights. This is an unusual one, but you gotta love it. This is a shish kebab party. I don't really know, how do you put it? Anyway, we have little white knights that look like little round men. And they're coming in with their skewers. And what they're doing is skewering the cancer cells and leaving the healthy cells alone. What a great idea. We've got white blood cells, healthy cells, choosing to take the cancer cells and leaving the healthy cells alone. That's a rather neat idea because chemotherapy attacks all fast growing cells. That's why people lose their hair and they get mouth sores, because hair and the mucosa in the mouth and the gut are fast growing cells. We need them to be fast. And they absorb a lot of the chemo, just like the cancer cells do. So this person's being very selective and saying, I'm just going for the cancer cells. And we can look at it and say, well, that's a really weird drawing. It doesn't matter. This is a drawing that worked for this person. And that's why it was empowering for them. This is one of the dogs eating meat. Anybody here who owns a dog knows how voracious they are. You put your dinner down on the ground and whoosh, it's gone. The thing also about dogs is that they're tremendously faithful and loving, and they can be ferocious, but they defend well. So that's kind of got a bigger message too. It's a rather lovely message of being cared for. Oh, this is a classic. I don't know how many of you spent time back in the day playing Pac-Man. I'm aging myself. But here we go. This is a variation on Pac-Man. This is a shark moving through the body, devouring cancer cells, just like the Pac-Man did. And down below are cleaners. Don't you think they're terrific? They've got themselves ladders. They're T lymphocytes. I can tell that because they've got big T's on their back. Isn't that great? And they're in there scrubbing. I just think that is working on two levels. It's working sort of in the microscopic area, and it's working on the organ area too. Now, this is a copy of Bernie Siegel's Love, Medicine, and Miracles. This is an older book from the 90s, but he was one of the sort of pioneers in understanding that cancer is more than a bodily experience. It affects the heart, the mind, and the spirit as well. And so he was an oncologist, Bernie Siegel, and he developed ideas for taking care of people in the broadest of senses. And he used imagery as well. And so here are working leukocytes, just another form of immune function. And this is a less violent image than some of the previous ones. These are the leukocytes picking up cancer cells and moving them out, shifting them out. And that's very cool. Some of the other less violent pictures are like gardening, pulling up the weeds, using less violent imagery fits some of us. I've got another picture coming up of something that's more holistic. Now, we can also use imagery for exploring our psychological experience. This is a picture of someone who saw herself as shut down and shut off and hidden when she didn't have cancer. This was pre-cancer, before she started the healing journey, before she started self-exploration. And this is the magnificent picture that she drew as she worked her way through the healing journey. She's big, she's bold, she's busting out of her box. She's got a big smile. There are people all around her. There's light, that yellow healing light. She looks robust and strong. I just think that's a terrific picture. It's a holistic picture. So healing, we can draw healing pictures in the microscopic level, or we can draw them at a broader level. And so in this picture, she's drawing herself, and as we look at it, we really can see how the dress is holding her up. The dress is the brightest part of the drawing. It's big, it's bold. She's put a lot of effort and time into drawing it. And she herself, her body is kind of pale in the background. She's written, I'm healthy and well. I'm enjoying life. I feel good. But as I look at that, I wonder. And so I might ask her, I notice that the dress is very strong. Can you tell me what getting dressed means to you? Oh, well, she says, I'm feeling really crappy on chemo, but when the kids come home from school, I'm sure to get up and out of bed and get dressed, and I put my wig on, and I present myself as strong and healthy and doing great because I don't want them to worry. Is that how it really feels inside? No, she says, I'd really like to be sort of in my chair resting in something comfortable and a scarf on my head, not a wig. I said, well, what would it be like for the children to see you that way? Maybe it's a more honest presentation. Maybe you can think about that. Knowing that there's no right way to do this. There's no right way to do cancer. There's just the way that feels right in the moment. So she began to explore the idea that maybe she can talk more about how hard she is finding it. And part of being in the healing journey gave her an opportunity to explore that. So here we have a tennis game. You've beaten me. And there we are on the other side, looking, well, quite small. And in fact, we're kind of off the page. The person who's drawn this is off the page, and you can barely see how his hand is holding the racket. Cancer is looking pretty intimidating, pretty big, pretty overwhelming. In fact, it looks kind of unfeasible that this small player is going to actually beat that cancer. Now, that's not saying that it's prognostic. That's not saying what's going to happen. What that is saying is today the cancer feels pretty big, and I'm putting up a brave front, but it's feeling pretty big. And that's part of the roller coaster, right? We've all been there, the ups and the downs, and some days it just feels overwhelming. So drawing it can give us a chance to acknowledge feelings that maybe we're just not quite acknowledging to ourselves in the moment. This is not the finished final word. This is one word, one description of how this process feels. Today it's like this. When the roller coaster goes up, it will feel different. This is a charming picture, again, drawn by somebody who was deeply involved in the healing journey. She sees herself as a butterfly, and she sees her immune system as little nymphs that are powerful and magical and floating around her body. This is really kind of rebirth, isn't it? I'm sure she stayed with that image for quite some time because I think it really described how she was feeling. And this is a more masculine image. This is the Cancer car wash, right? Why not? Why not? And so this person is wheeling their way through treatment. There is, what have we got? Chemo is the first one, then the T cells, and then look at that healing journey symbolized by light, rolling his way to the dead cell vacuum. So this kind of fun, it made sense to him, and I think it was a pretty great picture. I talked about these holistic pictures, that some people don't view healing in terms of their immune system. They rather see it as developing a sense of peace and calm. And that's what we have in this picture. The person who drew the picture is in the hammock, overlooking, I think it's the St. Lawrence River, and those are whales playing in the river, and she's watching them. It's peaceful and it's calm, and it's pretty powerful. And I think that was an image that really stayed with her. And notice how it was a felt image, like she'd been there. She knew what that felt like. It was, I guess it was her safe place. Some people will bring in spiritual images. This is a picture of Jesus coming down into a park or I think it was an orchard. And she's coming down here and meeting Jesus. He's full of light and he is bestowing healing upon her. And this is another sort of holistic image. You'll recognize there the concentric circles of the human experience, the body, the heart, the mind, the soul, right? All there. And within that comes the light that is healing all the way down into the core, filling her with healing light. And it suffuses all these levels until she glows. It's pretty good, eh? I bet it felt really good for her to look at that and feel that. Here is another picture. This is the Divine Mother. This is being held by a mother image. Again, suffused with light, feeling that sense of the hand wrapping around her and protecting her. So those are some of the images that we've collected over the years, and they're very disparate. Different people have different ways of looking at it and experiencing. So I would ask them at this point, what does the group think about trying this out? Thoughts, feelings, fears, anxieties, enthusiasm. In level 1, what I would ask is that people have paper and pencil with them so that they can capture words that describe the image. But in level 2, we want to ask people to bring drawing materials, and we can give them paper. They can bring their own paper. Hopefully they're working in their journal. And that gives them a chance to date it and to use it much as the pictures that we've seen, to come back to them when we're at a later date to explore them. So today I'm going to ask you to do some drawing just to know what it feels like, just to know what this experience feels like on the receiving end. And so I'm going to ask you to make yourself really comfortable. Alistair, again, uses the escalator image, and that's fine. I'm not going to use that today. You've got the script for it. I'm just going to use the way that I prefer to do it with light. Can you take a breath? Oh my goodness. Just take time to enjoy our breathing. Do we often give ourselves that opportunity? So I hope you're comfortable. I hope you've given yourself some time and space. You've turned off the cell phone so that it's just you and your breath. Sitting in a chair, feeling more and more comfortable. Maybe there's a slight sense of anticipation. And in this imagery, if you don't have cancer or you haven't had cancer, you can imagine a health problem that you have, a health issue that you'd like to address in imagery. That's the thing about imagery, and I often let people know they don't have to take the script verbatim just because I say it. If it's not working for you, go off in your own direction, do your own thing. You don't have to follow the instructions. You just need to make it right for you. So as you breathe, beginning to feel yourself centering in the chair, dropping your weight, letting your eyes soften, and imagining a beautiful beam of light coming in through the top of your head. The light is soft and warm, profoundly healing. It flows in through the top of your head and it swirls around the inside of your head, washing away the busyness of mind, washing away the thoughts, the distractions. There's no need to do anything right, just to be. Feel the breath, to feel the light as it now swings around your head, softening the muscles at the back of your head, around your ears, and gently sweeps across your forehead like a loving hand, releasing the furrows, gentling the brows, so they soften, your eyebrows soften above your eyes. Inviting that light to come in and around your eyes, gentling the muscles of vigilance, watching. Let them rest. And in doing so, you can invite yourself to turn towards the inner horizon. Feel that shift. Continue, move the breath, feeling the breath, move your body as the light comes down through your cheeks like a gentle caress into the muscles that cradle the jaw. Experimenting with how much tension you can release from your jaw. Opening your mouth, softening the hold, gentling. Letting your tongue come to rest easily in your mouth and letting your lips relax. And as we gaze inwardly upon ourselves, it is as if we have loosened the mask that we wear every day to allow a softer, beautiful face to shine through. Bringing your attention to your neck, taking a moment to adjust your body so that your head sits upon your neck, sits balanced upon your shoulders. Feeling that sense of letting go. And that light comes down through your throat, down through the great muscles of the neck, feeling them lengthening, softening. We get the balance just right. There's no pressure, no stress on it. You can feel the light go down to the silvery vocal cords, relaxing all the muscles and letting that light come down deeply into the shoulders. Sometimes the shoulders are like dried sponges. They're hard. But you know what happens when you take a sponge and you fill it with warm water. It becomes soft, warm, pliable. Let that light be like warm water playing down upon your shoulders. Feel your shoulders letting go of the burdens of the weights, putting down the knapsack. Feel the sense of your shoulders being free and comfortable. Let them drop down from your ears. Bringing your attention to your shoulders and then feeling the light cascade all the way down your arms, down to the delicate mechanisms of the wrists, all the way down to your hands, and then let that light flow into the palms of your hands. You feel the light gather there? There might be a warmth, maybe a tingling. Just noticing how that feels. Your hands heavy in your lap. It'd be hard to move them even if you had to. Just let them rest. Give them a break. We can breathe the light in, drawing it in and feeling the light fill your lungs. Feeling the light spacious, your lungs full. Feeling the rib cage relax so there's more space for breath and light. All that light in your lungs, it flows over and into your heart. Feeling, perhaps imagining every beat of your heart, sending light cascading through you, flowing through every cell in your being, whispering, be well, be well. The light in your chest coming down now to the diaphragm, and we fill the full roundness of the belly with light. Let the belly be soft. Imagine that light flushing through all the organs within you, bringing healing. Letting all the organs work together, synchronized, efficiently. Anything that's not in your best interest is just being flushed away by light. And the light, it keeps coming down through your head now, down along the back of your neck, and following your spine, vertebrae by vertebrae, flushing all the way around your shoulder blades. You feel your shoulder blades dropping down your back. Can you find that relationship with the chair where it just feels right? Where you feel held. It's all so effortless. Bringing that light down along the delicate curve, small back, and all the way around the tailbone as you really drop your weight into the chair. Perhaps in this moment, you don't need to hold yourself up. Perhaps in this moment, you don't need to hold up others. This is your time just to be held. Light now traveling down your legs to your hips, down to your thighs. Take a moment to let it fill your knees, such hard working mechanisms, the knees, and then flowing down, 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 right into the heels of your feet. We don't often think about our feet, except when they hurt us. Let's take a moment to massage them, feeling that light in your heel, right through the arches of your feet. And then feel how it flows into each and every toe, just touching in with your mind, each toe. You can even let the light flow down through the earth, giving you deep roots so that you're firmly moored to the earth and yet full of light and air, like a great tree, drawing in the energy of the universe, drawing in the energy of the earth, powerful, healing energy. So we wend our way to the healing room. You might imagine walking there or taking an escalator, or you may take a spiral staircase, step by step, moving towards this healing room that you know quite well. Step by step, every step all the movement, taking you to an inner place that belongs just to you, the healing room. Feel yourself moving more and more deeply inside of yourself until you come to the place where the door invites you in. As always, you push it gently, and there you are, back in your healing room. You can do all kinds of healing work here, and you feel yourself right at home, perhaps with a fireplace, a window, a carpet, pictures. However you've chosen this room to be for you, know that it's safe, it belongs to you, and no one can interrupt you. There's that comfortable chair. Let yourself sit in the chair and feel the support that holds you. Feel the support seep in so that any last vestiges of holding just fall away. And so today in our healing room, we're going to imagine what's happening inside the body, inside your body. You might imagine yourself traveling in like a small investigator with a flashlight, traveling into your body to see healing in action. If there are cancer cells in your body, take a moment to imagine them. If the cancer's been removed, just imagine what they might be like. See them as small, disorganized, broken. See them as confused. They've lost their way. See them any way that makes sense to you. Small, weak, confused. Now, bring into this scene, flood this scene in your mind with your immune system. Macrophages, the T cells, the natural killer cells. See them coming in with an innate intelligence, a power. See how many there are. Powerful. Their interaction with the cancer cells is not in dispute. They win. They know what to do. They know how to tackle the cancer. See that interaction in your mind's eye. See the power behind your own healthy body. See the immune system is strong and competent. And then see the vanquished cancer cells being flushed out of your body, cleaned up, maybe by the macrophages, maybe by light. See all of that being flushed away, leaving your body clean and healthy. And now bring anything else that you're doing to help yourself with the cancer. You might bring in chemotherapy, radiation, hormonal therapies, anything that you're taking or doing to help yourself. See that flooding into the area too, powerful and swift. It knows exactly what to do. Cancer cells are vanquished. And you can bring in anything else that you're doing to help yourself. You can bring in the healing journey, relaxation, healing light, the support of the people around you, wellspring, anything that you are doing that helps you feel strong. Exercise, walking, nutrition, anything that you are doing that helps you. See the love and support that is around you, the caring. Drink it all in, and then flood the area with light. Flood you with light. Just explore it. Play with it. Work to make the image that feels right for you. And if it doesn't come right away, that's okay too. It's a process. Know that this process continues on inside your body, whether you are thinking about it or not. It's continual. And then see yourself back in your healing room. See yourself doing the things that make you happy, centered, balanced, connected. Doing the things that feel right and healing to you. Enjoy these healing images for a few moments, and then very easily, very gently, perhaps counting from 5 to 1, you can bring yourself back to the room. I would be probably unlikely to talk about the image very much right now. People are relaxed. I'll give them time to do some writing or sketching. In level 2, however, we front end the session. We remind people about imagery. We show them some of the pictures if they'd like to see that, with a PowerPoint presentation. But we do the imagery earlier in the session so that people have a chance to write it and draw it, and then bring it back to the circle where we ask them to show us the pictures, describe what's happening. What I would say to people is, can you tell me what's going on in this picture for you? Tell me how it feels. What's your feeling as you look at it? How did it feel drawing it? What do you see? Is it telling you anything, do you think? Could you imagine this picture changing in time? How would you imagine it changing? Exploring it in these gentle, very, very non-judgmental ways. Just encouraging people to talk about it, explore it, and never pretending that you can see something in the picture that they can't see. That's always the fear, that I'm revealing something about myself that you can see that I can't see. So we want to make sure that we give them the power of interpretation. We can nudge them. Can you tell me more about this part of the picture? What kind of changes might be helpful? I'm wondering what it might be like to bring in more immune bodies. You think having more immune cells, does that feel possible? Those kinds of gentle questions. And then we open it up to the circle and say, what do you think of this drawing? How do you experience this drawing? And that question, people are always very supportive. I've never heard anybody, in all the years, I've never heard anybody say, oh, that's a stupid picture. I've never heard that. Everyone's equally vulnerable and equally supportive. So that's how you will manage level 2. That's just an introduction to it. So we finish with a story before we do our healing light. This is a story by Rachel Naomi Raymond. She wrote some wonderful books like Kitchen Table Wisdom. Very insightful. So she uses imagery, and she has this lovely story. As a physician, I had a man come to my practice with bone cancer. His leg was removed at the hip in order to save his life. And he was 24 years old when I started working with him. He was a very angry young man with lots of bitterness. He had a deep sense of injustice and a very deep hatred for all well people, because it seemed unfair to him that he had suffered this loss so early in his life. I worked with this young man through his grief and his rage and his pain, using imagery and psychotherapy. And after working with him for more than 2 years, there became a profound shift. He began coming out of himself. I think of that picture of the woman busting out of the box. We sat down to review our work together. And he talked about what was significant to him, and then I shared what was significant in our process. As we were reviewing our 2 years of work together, I opened his file and discovered several drawings that he had drawn back in the beginning. Look at this, he said. And he showed me one of his earliest drawings, and I suggested to him to draw a picture of his body. He had drawn a picture of a vase, and running through this vase was a deep black crack. This was the image of his body he had drawn, and he drew that crack over and over again, grinding his teeth with rage at the time. It was very, very painful to him because it was very clear that this vase would never function as a vase again. It could never hold water. Now, several years later, he was coming back to this picture and he looked at it and said, this one isn't finished. Okay, I said, here's a box of crayons. Why don't you work on it? He picked up the yellow crayon and putting his finger on the crack, he said, you see here, this part here where it's broken? This is where the light comes through. And with the yellow crayon, he drew light streaming through the crack in his body. We can grow stronger at the broken places. Isn't that lovely? So we would then do light, feel ourselves fill with light, sending light to ourselves, always first to ourselves. And then when we are full of light, we offer it to others like a conduit for light. Now, one of the questions that may come up is with patients with leukemia. Leukemia is a disease of the immune system. There are several different kinds, and it's hard to imagine the immune system functioning well when blood counts are very off. So one of the things that we suggest is to imagine the immune system developing normally in the bone marrow, understanding the disease, and then seeing how the stem cells in the immune system can grow healthily rather than being malformed in the bone marrow, and then seeing it flooding through the system in a healthy way. We had one patient who had a complex form of leukemia, and she drew a healthy immune system all over her walls. I think of her dining room. She painted this massive picture of how her immune system is functioning. Some people get so excited by this work, they'll pin pictures up on the fridge. They'll download pictures from the internet of the immune system because it's a good reminder that their bodies are not passive. So that's our session then on imagery. I hope it's been helpful. I hope you find it interesting work. And we will continue then with our last session coming up in our next one. Take care, and thanks for joining us.